Good morning. Welcome to the Point. This week, we start to focus on some of those primary matchups that you'll be asked to decide in August. We'll take a very close look at the race for governor for Republicans, Democrats, and Libertarians. Same for U.S. Senate. But this morning, we start with the state Senate race in the 19th District. That's where a Democrat and Libertarian are not challenged in the primary, but two Republicans have stepped up to the plate. First, we hear from former state representative Mike Callton. Let's talk about this run for Senate. Obviously, you spent your time in the House of Representatives, so you know what you're up against when it comes to the legislative pressure, but you also know what it's like to get out and campaign. In fact, you came here for this interview immediately from knocking on doors, talking to voters. That's a large part of what running for State House and State Senate is, isn't it?
It's huge. Your communication with the voters, I think it's going to be the more people who can touch the most voters, talking to them is going to win this one.
When you look at the issues today versus 8 years ago when you first started running for the House, are they the same? Are they different? Have you met some of those needs?
They've changed. When I first ran 8 years ago, everything was about jobs. You know, Michigan's unemployment rate had gone up to like 14%, and it was jobs, jobs, jobs. Now what's interesting is I'm not just talking to people, but I'm visiting townships, villages, cities, and now the big three is roads, roads, roads. And even though the legislature did have a solution that was voted on and I was there, it's going to take time for that to kick in, but I still think there needs to be some changes to even that to really solve some of the road problems that we have.
When you say changes, do you talk about more money or a change, for example, to the formula, the PA 51?
The change to the PA 51 formula. I think that counties don't get enough money and townships don't get any money even though they're required to pitch in. I think they should get a taste.
Is that a matter of just changing? And if you change that, the PA 51 was passed in 1951, so the strategic needs may have changed. Part of that money goes to some mass transit. So you would just change the formula rather than trying to get more money?
Well, the more money's coming. We're basically going from $600 million to $1.2 billion over the course of several years. So as the money increases...
Additional money. That's additional money.
So as this money increases, this is a good time to change the formula because you won't have to take away from anyone. Everyone will still have more money in the end, but I think more money needs to go to counties, villages, cities, and townships right now are not in the formula, and I think they should get some money.
When you talk about how it's changed, obviously you accurately point out that the jobs condition is much different, but I know in some areas, I don't know if it's true in the district in which you're running, the problem is almost inverse. Employers are having a hard time finding enough people to fill jobs in some cases. Is that true in your part of the world?
This is true, that employers are having trouble finding people, and we have a lot of agricultural work in my area, and it's hard to find people that will do that kind of work. There's not as many available employees. And then there's other sectors where they can't find people with the right vocational skills or technical skills.
What do we do about that? The governor has suggested something called a Marshall Plan to help prepare people, maybe with 18 months or 2 years of training, to get into a job that he says will pay a good wage, somewhere north of $75,000 for some of those, rather than going to a four-year college.
That is the right thing for some people. Not everyone is meant to have a four-year degree, and some people will do very well with journeyman skills in some kind of vocation, electrical, plumbing. There's several areas that they can do extremely well. And I saw this interesting statistic that workers with journeyman level skills make as much as the college-bound student that get master's degrees.
When you talk to voters, we heard 2 years ago that they were all fed up one way or the other. They were mad at government. They didn't think Republicans were doing their job. They didn't think Democrats were doing their job. They had a lot of anger towards Washington, a fair amount towards Lansing too. What do you hear from voters?
Generally, I have very good experiences knocking doors, but I have knocked a few doors that did not go very well. One man, I won't get into the exact language he used, but very fed up with politicians. I've noticed that a lot of what they're mad at is more at the federal level. They're mad, say, at lifetime benefits, whether it's pension or health insurance, and I told them that we voted to get rid of that at the state level. As soon as I left the House, I had no more health benefits, and basically we had a contribution program where if I contributed so much, the state would contribute so much, and when I left, I took that with me. But there's no pension. We changed that in this state. So they're a lot of times mad at things that are happening at the federal level.
When you talk to voters, in addition to jobs, in addition to roads, the one issue that we've talked about in campaigns from the beginning of time, from the beginning of my time here, has been about school and school funding. Obviously, education, that pre-K through 12 education that remains the vital part of training for any job, for the basis for anything that you're going to do going forward. And very often people have complaints about schools, or more specifically school funding. You run into that?
Yes, you do run into that. I was once the president of a school board, and the best thing for schools is when they have slow growth, steady funding, as opposed to roller coaster funding, which that's why I was concerned about Proposal A way back when. I thought that, well, okay, they're going to reap an economic expansion right now, but when things go down, it's not going to be good. And that day came, that day of reckoning, and schools don't do well with this. They need this.
And one of the problems that schools experienced, in addition to the funds not coming in the way they had been when we were in the mid-2000s, a lot of schools saw some large decreases in enrollment, and since it's a per-pupil funding scheme, that was kind of a double whammy for some of those districts.
Yes, I've seen the district that I was at. At one time, they were almost going to hit 2,000 in the school district. Now they're under 1,500. And that is a huge cut in the amount of money they receive.
What other outside factors are there out there? I know you and I had discussions about medical marijuana years ago, and this year, unless the legislature takes it off the table, and I still think that possibility exists, but we'll see, there could be a ballot proposal to legalize recreational marijuana. First of all, does that have an impact on races like yours if you're successful and through the primary and make it to November? And or is that a good idea?
Well, it definitely will bring more liberal voters out to the November election, and that could have an effect in areas that are very close. And there are areas that are very close. One thing I noticed that when I was in the House, I saw a swing of approximately 22 seats. The Obama pendulum one year, and it swung back to the Snyder pendulum 2 years later. And my observation was, of the 110 House seats, only 22 were really that movable, could be Republican or Democrat. So when you get into those kind of seats, which mine is not like that, it could change that, if you get a few percent more liberal voters. As far as what I think of what they want to do with voting for the legalization of marijuana, I worked real hard on the medical marijuana issue because I know that certain types of patients really benefit from medical marijuana. I saw it with cancer patients to help them with their appetite. I saw it with epileptic children, help them with their seizures, and I see it in my own patients with chronic pain, helps them with their chronic pain. I know it helps certain classes of patients, and the work I did on it was designed to A, take out the criminal element from it, B, make sure the medicine was tested so that patients were getting a quality product, and C, to make it so that there could be taxes that you could get from it and communities could benefit from it. And even the Fireman's Cancer Presumption Fund benefits from it. Now, this new legalization ballot initiative, I don't think meets those criteria. And that's why I'm very skeptical of it.
Do you think, looking back, because we did shows about this, you and I had long conversations about this, Do you think the implementation of the medical marijuana provisions has been uneven? It seems to me that from community to community, the ability for somebody who, as you prescribe, that would need it, the ability to get medical marijuana even now changes from place to place depending on local regulation.
Well, that's true. The bill was designed so that if the community didn't feel it was right for them, they didn't have to have it. They could vote to have it. They could vote to have certain portions of it, like maybe they would allow a testing laboratory, but not a retail. Maybe they were willing to have a transportation company, but not a grow. It was designed that way so that it wouldn't be forced on any community against their will. In Ann Arbor, they couldn't wait for something like this. It's a very right thing for their community, but in West Michigan, it's a different kind of community. And so the patient in Ann Arbor is going to have much greater access than the patient in Grand Rapids.
The 19th district that is currently held by Republican Mike Knopf is made up of Calhoun, Berry, and Ionia counties, and you'll hear from the other Republican in that primary, Representative Dr. John Bizon, next. To the Point. Welcome back to the Point. This morning we're starting to take a look at some of those primary races that you'll be deciding in August. Right now we're looking at the 19th Senate race, so where two Republicans are squaring off. Here's our other candidate, Representative John Bizon. Representative, let's talk about this quest that you're on. When you first got into this, coming from the medical field, there had to be a pretty steep learning curve when you start running for office because it's a big undertaking. Now you've decided to run for state senate. What possesses you to do that?
Well, I think there's still a lot to be done in the field of healthcare, and healthcare is what got me interested in this at the very beginning. As you know, I've spent the last 40 years in medicine, and I've been president of the State Society, and I've been able to go to Lansing and say that I represent 17,000 Michigan physicians. And the answer I got back after the usual song and dance of the day was, let me check with Roger and get back with you. Roger, of course, was Roger Kahn, who was a cardiologist, but more importantly, one of their own. And I still feel that if I'm going to make a significant contribution and have my voice added to the voices of those in Lansing, that it has to be one as an equal, not as a lobbyist, not as someone coming in from the outside, but one of their own who they trust.
Tell me a little bit about healthcare from your perspective and what needs to be done on the state level, because significant changes have been made in healthcare over the past few years, including the Healthy Michigan bill, which in and of itself may be under some scrutiny going forward, particularly as it comes to cost containment. So what needs to be done from your perspective when it comes to healthcare?
As you know, I'm an old military officer, and in my military training we were looking at threats worldwide, and the threat that was identified in this course I was taking called the Air War College was the national debt, and this is 30 years ago. This is back in the area of having the Cold War, having China, having Iran take our hostages, and we just looked all around the world, and of course there was China there too, and said, what is the greatest threat to America? And at that point in time they said, our national deficit. At the time it was something like 2.4, maybe 2.6 trillion dollars, and they said, we simply cannot sustain this sort of growth in our debt. Pretty soon we will not have money for anything. And there was concern among the generals and the professors of this leading to significant changes, or perhaps even the end of America as we know it. That resonated with me. And now we are sitting at $21.1 trillion in debt. And we have to find a better way of doing things. We spend 18 to 20% of GDP on healthcare, and that's twice as much as any other nation in the world, and we have to do better. Our Medicaid system needs to be reformed so it takes care of patients and gets us to healthier. We've had the expansion of the Healthy Michigan plan. How did that impact the governor's dashboard? Not very much at all. We have the same obesity that we've had. We have the same diabetic complications, the hypertensive. We have done a good job in neonatal mortality. That is one area where we got significantly better. But if you ask, are we healthier than a state now that we're spending an extra, I think it's something like $4 billion on our healthcare expansion? I think that answer is no. And the governor's dashboard, I think, is going to support that. You just have to look at the numbers.
Well, how do we do that? I mean, I think that's very interesting coming from somebody with your background. If more people having more coverage, presumably having more coverage, isn't changing the needle on our overall health, then what will? I mean, because the promise was that you'll have preventive health, people will be healthier because they'll be able to go get care. They won't have to go to the emergency room waiting until they're so horribly sick that they have to go. But if it's not coming true, what will make that happen?
We need to motivate people to do better. People need to take control of their health care and their health. You know, it is in everyone's interest to do well in health care. If they want to see their grandchildren growing up, if they want to have healthy, fruitful lives, if they want to feel well, and there is something that is grand just about feeling well, we're going to need individuals to take responsibility for their care, for their health, and find out what it takes for them to get better. As a head and neck surgeon, I saw a lot of people with head and neck cancers. And we would fillet open their necks and we would remove the cancers and then hand them over to the radiation oncologist and the medical oncologist to give them their chemotherapy and radiation that would follow afterwards. And a lot of times it took me sitting down with them saying that you have two choices. You can go down the road of continue to smoke and you will get your cancer back, or you can go down the road of giving up and having some chance of having longevity and time to spend with your kids and your grandkids. I think we need to do the same things and have people responsible for their hypertension get to know about the disease, be able to treat the disease themselves and not rely on someone else to take care of them, because the very best person who has their interests in mind is they themselves.
I want to shift gears a little bit, because you're talking about, as we get ready for this primary, you're talking about if you're successful in August and if you're successful in November, moving into the Senate, which is on some levels different, but it is kind of a continuum of what you're doing now in the House. What is it you know today about being a member of the legislature that you didn't know when you started on that quest a few years ago?
I was thinking that a lot of the skills that I had previously acquired from years in medical practice, but also as chair of the medical PAC of this state, as president of the State Medical Society of this state, and on the legislative committee for a number of years, probably 15 years, would have given me skills that were transferable. And I find that this is a brand new skill set, that this is a new set of skills that require different answers. And when I walk into the room, I find that I am not their expert as of yet. I'm hoping to build their confidence. Just because I have the degrees, just because I have the experience, doesn't necessarily give me all the credence that I would like to enjoy in that caucus when we sit down together as a group, or within the House when we are together as a full membership.
Well, as a former Speaker of the House once explained it to me, trying to get 110 members together is like herding minnows. And so you may be experiencing part of that. What beyond healthcare, what are some of the other issues you think face the state as you prepare, if you're successful for this next phase?
One of the real big issues that we have are our roads, of course, and that's going to be a major issue. We're going to need to find ways. And I would argue that we aren't doing our roads well enough. We're putting $5.3 billion, or a massive amount of money, to our roads here in the state of Michigan, and you see what we drive on. In the previous session, we had $100 million in an innovation fund, and then at the end of the year, that was released to the Roads Department to do the work on the Roads Fund. I think that that was the right idea. We need to get our universities out there to show us, do the research as to how we can make better roads. Is it a better material? Is it a better foundation? Is it, You know, why is it that our roads last 6 years in spite of the fact that we bond them for 30?
The question about are we building roads right is one that I've heard ever since I've been in Michigan. And what I'm hearing you say is perhaps that we're starting to recognize that we need to find a better way. Is that something that MDOT has bought into?
Not terribly well. We are trying to encourage them as best we can. But we have other challenges out there too. Auto no fault, for instance. We've been promising auto no fault. In my mind, every person who plays in the auto no fault arena has learned over the past 30 years how to game the system to maximize their return. I think that we need to go back to the initial founding principles of auto no fault, where we take care of the injured, we allow for their rehabilitation, we get the lawyers out of the system to minimize the costs, and I think that there's a lot that can still be done. I was willing to work with Lana Tice on a overhaul as I would see it from my perspective, and see whether or not we could sell it to the other members of the House.
The auto no fault conversation is as old as the law itself. I think about 2 minutes after it was passed, that conversation started. But the problem has been, at least in the last 25 years, is that you have such powerful lobbies on both sides of that issue that to come to consensus, to get people to agree, is pretty difficult. So how do you do that when you've got these big moneyed interests out there, including the medical field and insurance people, and lawyers and all of it?
And everyone has their own little niche, and everyone has their own little piece of the pie. And I think that we'll be very, very happy if everyone walks away just a little bit unhappy. And when you say, how do you do it? I think that if we had a plan that provided care, but cut the costs of the plan, so we would still have the very best care in the United States, but that cost would be cut 50%, so we would be down somewhere in the average payments for. So if you could get the very best care in the United States following an auto accident and still pay about half of what you do, would you be supportive of that? And the answer is yes. I think most citizens would be supportive of that. And if we have a program that is able to cut your costs that much, and we take it to the public and say, do you want this? Do you think that if the citizens want this and their representatives do not, that's going to play well, especially given our 2-year cycle, election cycle out here? You know about this much more than I. You've been covering this for a much longer period, but do you think the lobbyists will still have that much clout if we take it to the people?
As we pointed out earlier, the Democrat and Libertarian in that race do not have a primary, and third-party candidates are likely as well. We'll have more when we come back to the point. So this morning we start looking at some of the important primary races that you'll have to decide in August. And of course there are many, many more. A big race for governor for both Republicans and Democrats. And in the U.S. Senate race, at least 2 Republicans are squaring off to face off with Senator Debbie Stabenow in the fall. We'll be focusing on all of that, and there is more. In Lansing, they're trying to wrap up a budget, and on Mackinac Island, the Detroit Regional Chamber will have their annual event where politicians from all over the state will arrive and try to convince some of the decision makers that they should get their votes and maybe even some financial support. We'll have it all right here every Sunday morning at 10 o'clock. To the point.